Hello, everyone, and welcome to what we at the Biodigestors are going to consider our very first episode being released to the public during this special time frame, which, of course, is the pandemic. Now, truly speaking, we are about 4 to 5 weeks into the fall 2020 semester, so this won't actually reflect our true first episode, which will be released when things go back to normal and we can actually get back to shooting what we are going to consider our highest quality videos that are still yet to come. And before we get into the actual video, I just like to take this time to introduce who we are. As you might have heard, we are the Biodigestors. My name's Brad Cerniak. I'll be your lecturer throughout the series that we create, and the person behind the scenes doing all the editing, adding all the bells and whistles, and basically making me look great is my friend and partner, Steve Blazek. Together, we are the Biodigestors. Now, me and Steve both agreed that it was really important to release these videos due to the current circumstances, but again, I would like to stress that we have intentions of making significantly higher quality videos, even though we think these are really good educational videos. They're just not the standards that we're shooting for, but with the current circumstances, we really wanted to give students an opportunity to learn from the videos that I actually use in my class. So sit back and enjoy the video series that we continue to release. If you like our videos, please hit subscribe, hit like, and if you really like what we're doing and want to support us, we've included a spot to donate below and a link, and please feel free to do so. $1 or $2, $5, that can go a long way to build up to what we need with certain supplies we need to purchase to get to that high quality education videos that we're trying to, and trust me, they're going to be even better than what's currently being released. So if you feel like you're learning a lot now, give us the opportunity, support us by clicking subscribe, clicking like, and if you have the capacity to do so, chip in a few bucks to help us get the things that we need to continue to make these videos. And with your continued support, we promise we will continue to reshoot, re-edit these videos to bring them up to the quality that we are anticipating that we can get to, and we guarantee you will enjoy what we're able to bring. So let us show you our passion for learning and education, and enjoy the following video. Hello, students, and welcome to our lab lecture on the skeletal system. And we can see the skeleton sitting right here, all 206 bones. We can spin this model around and you can see all the different aspects here. And so that's what we're dealing with today, is the human skeleton. And we're going to be dealing mostly with looking at the vertebrae and kind of the axial skeleton here. We're going to exclude the skull on today's lecture. We're going to do the skull as a completely separate lecture just because of its complexity, but we are focused on the axial skeleton. And again, if you remember, if you just kind of took a straight line running through, that would form our axial skeleton. And then the only other thing that we have to include within this straight line would be the ribs. So the ribs are the only thing that's not touched upon this straight line that is part of the axial skeleton. But if you notice the ribs, and let me zoom in here, you can see the ribs, of course, are articulating, and that term articulating means coming in contact with or forming a joint. And it forms a joint with this, which is the sternum right here. And so that's what we're talking about, the axial skeleton. So literally, again, if we're running straight down, all right, so this is all the axial skeleton, and then notice directly attached to the vertebrae are the ribs, and so that classifies them as part of the axial, and that kind of ends the axial skeleton there. All right, so make sure you can distinguish between axial and appendicular. Appendicular includes the clavicles and the scapula, and then the arms, which is pretty easy to see. And then it includes this, which is, the os coxa, or coxal bone, or ilium ischium pubis, because that is 3 bones. That, of course, forms our hip bones. And that is also part of axial. But this right here, because it is part of the straight line down, notice coming straight down, I am hitting into the structure known as the sacrum. The sacrum is axial, but the little pelvis bone here, known as os coxa or coxal bone, is part of appendicular. So you need to make sure you can distinguish between those two, but really I'm going to be focused on pretty much all of the axial skeleton, specifically the vertebrae, the ribs, talking about some of the key structures related to them. Like I said, I'm going to save the skull lecture for later
just because the skull itself is so complex here. So I'm going to break down and remove all of the bones of the appendicular skeleton here. So I've removed two major aspects. I removed the skull. As you can see, the skull is no longer there. And remember, the skull is part of the axial skeleton, and then everything we see here makes up the axial skeleton. So the parts of the appendicular has been removed, as well as the skull for the axial skeleton, just because I'm going to, again, cover the skull separately. But what you can see here, and if you're listening to the lecture, you can definitely see our major bones here. All right, and so notice there is the hyoid, and notice that's a really cool bone. Let me zoom into that there just to show you. All right, and so this is the hyoid bone right there, and it is one of the only bones that does not articulate with another bone. Notice there is no direct link here. And this is one of the bones, as you can see, based on where it is, it's close to the throat region. This is one of those bones that, um, that singers may get injured. And so this is a bone you should identify, and you should be able to identify as the hyoid. You can see its prominent look. And again, don't forget to use your book. It's always important that you compare some of these images to your book's images so you get a much more well-rounded idea. But this is giving you that 3D perspective that your book does not and is incapable of doing. All right, so know the hyoid bone, but I am going to remove it. So I'm going to kind of hide this bone because it's not one we're going to discuss besides knowing it's the only bone that has no articulations and just being able to straight up identify it as the hyoid. We're going to be identifying so many different markings that to me, to worry about a bone that's pretty, it's rare, it's odd to be a non-articulating bone. I don't label this up. We're going to have so many other things to label. So let's zoom back out and really start talking about the major aspects of the axial skeleton. All right, and so again, axial skeleton overall, you need to know, contributes to a total of the 80 bones, where appendicular contributes to 126 bones. That is definitely something, hands down, I would expect you to be able to identify. But let's focus on the two main aspects. And so from our lecture, we talked about the vertebral column, right? And so we talked about the vertebral column, and I'm going to show you specifically what the vertebral column is without the thoracic cage. So I'm going to remove the thoracic cage. And as you can see, now that the thoracic cage is removed, this is the vertebral column, literally the vertebrae, and hence the term vertebral column. And we call it the posterior support. I mean, it's literally forming the posterior portion of our body. So it should be easy now that we got a really great model to display these things right here. And so notice when we're talking about the vertebral column, what we're talking about, or the vertebral column, what we're talking about is all the vertebrae, which there are 24 of them. All right, so it's 24 total vertebrae. The sacrum, all right, and then this little piece down here, this is the coccyx. And so you should know what the coccyx is, be able to identify it. Notice that's the sacrum, another bone you should be able to identify. The sacrum is composed of 5 fused bones, which is pretty common for me to ask. And similarly, the coccyx you should know is the tailbone. It's 3 to 4 different fused bones. I usually don't ask much about it besides saying, hey, be able to identify the coccyx. But sacrum, I definitely expect you to be able to recognize that it is 5, specifically 5 fused bones. Now, of course, there are exceptions. There's always exceptions to that rule. That's what, disease are or abnormalities. And it's not necessarily, hey, if this was 6 fused bones, it wouldn't really be a disease or anything, but it would be abnormal compared to everybody else. And so when we talk about bone numbers, understand, again, we're talking averages, and we're going to stick with averages because that's, the average. So we're going to end up sticking with that. All right. So this is one important part of the axial skeleton, and we're going to break down the cervical, the thoracic, and the lumbar vertebrae here. So we're going to break all these different vertebrae down, and we'll get to see the various aspects, and then we'll go on to the sacrum, and we'll go on to the coccyx. All right, but make sure you understand that this represents the vertebral column here. Now I'm going to end up showing you, and I'm going to get rid of the vertebral column, and I'm going to show you the thoracic cage here. So now the vertebrae are removed, what we have is we have the thoracic cage. And so notice this is the thoracic cage. And when we talked about it in lecture, we said the thoracic cage is going to be the anterior and lateral support. All right, so that's the thoracic cage, anterior and lateral support, which is certainly what we're currently seeing here. All right, so here's our anterior, and then there's the lateral side of the support. And that's what's what's making up our thoracic cage. So what we have here is our specific, all right, our specific ribs. And I don't get too detailed with it. I'll throw in some extra details that I think you should know. But we also have the sternum right here. So sternum and the ribs. And the sternum does get broken down into three key parts that hands down you should know. All right. And so what we have here is we have the sternum. And what they didn't do is they didn't break down the specific parts on this, but the superior portion of the sternum, specifically right up here, is called the manubrium. All right, and you definitely need to know the manubrium. And the other aspect is in the center of the manubrium, and I don't think this is showing it exactly as well as I was hoping, but the center top right here of the manubrium, you need to know there's a little ridge, and it's not shown so well, so if you use an image, you'll see it. But the top portion is known as the jugular notch, all right? And that's what I expect you to be able to recognize on the manubrium, besides recognizing the manubrium as a whole. And then on these corners, right at the top, so kind of an angle right here, and again, it's not as nice as on this model as I would have hoped, but that's called your clavicular articulation or your clavicular notch. Either term would work. It's a clavicular notch is usually what I go, but your book, I think, uses clavicular articulation. But either way, you should be able to recognize that because that's where the clavicles are going to articulate. So got the jugular notch in the center, and then we have the clavicular notches or clavicular articulations on the sides, and that's where the clavicles will be. Now, the last thing I want to point out about this manubrium and what's so interesting is when we look at the ribs, you should really know your first rib. You should be able to recognize this because it is a little bit different. Notice it's pretty short, and the interesting part compared to, notice the second rib gives us our kind of average rib appearance, right? These all kind of look the same. The first rib is really, really condensed. And one of the things I always ask students about the first rib is what's unique about it? And what's unique about it is it's the only rib that articulates specifically with the manubrium. All right. All the other ribs are going to reach the sternal body, as we can see here. All right. So this is your thoracic cage. Now, I'm going to break down, since I have the thoracic cage on here, and there's not a lot of major points that I expect you to know related to the thoracic cage. I'm just going to start the lecture here, and then we'll go back to the ribs specifically. All right. So one of the things that you definitely should be able to recognize is costal cartilages, and that's these right here. These are called the costal cartilages, and you can see they're cartilage. All right. So that's the costal cartilages. Make sure you're able to recognize them. And then one of the things that I expected you to know also about ribs is what are true ribs, what are false ribs, and what are floating ribs. And so your first 7 ribs, all right, there's 4, 5, 6, 7. Notice these first 7 have their own specific cartilage. So notice the cartilage is extending and going through. So 1, 2, 3, 4, 5, 6, and 7. That 7th costal cartilage is where things kind of end, right? We don't have an 8th costal, 9th, 10th, 11th, 12th. So the first 7 ribs that really create the costal cartilages are considered true ribs. And that's because, again, they're creating. The 7th one here is lined up right there. Now notice 8, 9, and 10, those have costal cartilages that kind of just run into and kind of fuse with the remaining cartilages. All right, and so those are considered false ribs. Technically, 8 through 12 is considered false ribs, but these two here, if you notice, we got number 11 right back here and number 12. So notice 11 and 12, keep missing. So number 11 and 12, you can see those don't actually have articulations or costal cartilages. So those are also considered false ribs, but I want you to learn them as floating ribs. All right. Learn them as floating. I usually expect you to know these more specifically as floating. Technically, it is true that 11 and 12 are considered false ribs. But when you think of false ribs, I want you to think and relate it to the costal cartilages and understand the reason that we consider these as false ribs is they don't have a direct connection to the sternum. But remember, ribs number 8, 9, and 10 8, 9, and 10 down here, they do have connections, but notice the costal cartilages all come together and then kind of become part of, 6 and 7's costal cartilage. It kind of just fuses with that. And so those are the false ribs. And then these are still considered false because they don't interact directly with the sternum, but learn them, like I've said, as floating ribs. All right. So now I just took down and I removed all the ribs just to talk about a few key markings on ribs that you should understand. I'm going to use right now, this is technically ribs number 9. So I am technically using a false rib for this, but I think the bigger the rib, it kind of shows a little bit better. I kept both of them on here so you can see them. But what you need to know is essentially 4 major regions of the rib, which isn't too difficult. All right, this posterior side that's going to interact with the actual vertebrae, you need to know that that posterior side, the very tipped point, is known as the head. All right, so the very tipped point is the head. Again, use your book to get you a little bit better image. This is a decent perspective. All right, so no doubt about it, a decent perspective. So we got the head, and then the next region is considered the neck. So this little area would be the neck. So the head is actually, if I was going to point to the head, just so you know, I would literally have like an arrow pointing at this specific segment. And then this little region right here would be the neck. So same thing if we just rotate around. We got the head technically right here. We have the neck being this region. And now notice we got this kind of sharp point at the top. And so when you see this kind of divoted up point, that's again one of those tubercles, which we've seen that term, right? The greater or lesser tubercle of the humerus. Here we're seeing again a tubercle on the rib itself. So know that kind of point as the tubercle right there. All right. Then the rest of this region, this whole region right here, the remaining part is known as the shaft. And the final thing I want you to know that this is the part that articulates with the actual sternum. So this would be the sternum articulation. But again, this truly would be where the costal cartilage would begin. So I guess know this as where the costal cartilages begin, because that's where the extension to the sternum. So it's not truly the direct articulation site, but this is where the costal cartilage is. So you got simply put, you have your head, you have the neck, and then this upper region is the shaft. All right, so head there, neck there, and then that specific point right at the top there, that will be your tubercle. Now, same sort of thing, I'm going to pull up the first ribs and go through it and review it with the first rib, because the first rib is pretty prominent to see these, and it might be a little easier to see them. So again, rib number 1 is super important to be able to recognize. I definitely expect you to be able to say, hey, that's the first rib, looking at that, hands down. And like I said, it's unique because this is the only rib that specifically articulates with the manubrium. And if you notice, you do have that same sort of setup here. We have, of course, our head region, all right? And so again, the head region, I would have an arrow literally pointing to the tip. So just imagine I drew an arrow right there. It's kind of how the arrow would be going. This is the entire neck, all right? So this whole region right here is the neck. And now notice the tubercles really stand out on this, which is really why I wanted to show it. And just so you know, if I want you to find and identify tubercles, they will be this sharp and jagged. That previous rib example I used really didn't have a prominent tubercle, so this would be a much more likely candidate for me to say, hey, identify the rib tubercle. So you got the head here. The head is the specific articulation site with vertebrae. You have the neck here, and you have the tubercle up there, and therefore the rest is the shaft, and then this is the site where costal cartilage would begin. And that kind of covers the main points for ribs. So don't overthink ribs. You should know what are free ribs, what are floating ribs. What are true ribs, what are false ribs, and what are floating ribs. You should be able to distinguish between those. And then literally the head, neck, rib, tubercle, and the shaft, and then site where your costal cartilages are. And if you got that down, you got all the main points for ribs. So ribs shouldn't take you too long to study and kind of understand. So now I'm going to pull up the vertebrae, and we're going to start reviewing the vertebrae. But before I actually bring up the vertebrae, I do want to pull back up the sternum and briefly talk about the sternum. So here we have the sternum. As I said, know the manubrium. I started to cover that, and I kind of went away from it. And I think if I show it from the posterior perspective, you can see a little bit better of that jugular notch, and then the clavicular articulations or clavicular notches. Either term you use there would be perfectly fine. And you'll learn that in anatomy, that there are minor nuances with naming something. All right, so that was the actual manubrium. This whole thing you should know is the sternum, but this is considered the sternal body right here. All right, and that's where most of the ribs will articulate. They articulate primarily with the sternal body, specifically the costal cartilages. All right, so when I say the ribs articulate here, it's technically the costal cartilages, but we tend to say the cartilage is the extension of the bone. And then down here, you should know this is the coccyx. All right, I'm sorry, not the coccyx. It's the xiphoid process. I don't know. The coccyx is your tailbone. This is the xiphoid process. XIPHOID. So the xiphoid process. So make sure you know this is the xiphoid process. All right, and that kind of completes our ribs and essentially the thoracic cage on all the things I wanted to cover. So not too difficult to study. Manubrium had the most things, then knowing the different parts here, and that's it. And just so you know, this was the xiphoid process is likely to get bent or damaged during CPR if you're doing it right to save somebody's life. But I'm sure they'll appreciate the little bit of damage. The fact that they end up surviving is probably more important. So this is pretty common to damage. All right, but now we're going to start pulling up the vertebral column and we're going to start breaking down the vertebrae here. And now that we have the vertebral column displayed, don't forget we have our two primary curves, which was the thoracic curve. You can clearly see this one. And then we have the sacral curve. Those are the ones that bend posteriorly. And then our secondary curves, remember, these are the ones that develop after birth. We have our cervical being a secondary curvature. That develops when a baby starts to learn how to hold its head up. And then we have here the lumbar curvature, which is, again, a secondary curve that develops when an infant is just beginning to learn to walk. Again, cervical vertebrae, thoracic, lumbar, sacrum, and coccyx. Those are the important things to identify. But we're going to break down each category of vertebrae. We're going to start with, of course, the cervical. So I'm going to remove these inferior portions or the inferior vertebrae. So the thoracic vertebrae, lumbar vertebrae, and sacrum are about to be removed here. So what we're seeing right now is our 7 cervical vertebrae. Now I'm going to break this down even more. I'm actually going to look at the top, or if you remember, the top vertebrae, or C1, right? Because we label it cervical first vertebrae, so it's called the C1 vertebrae. And there they label it C1, but notice they call it the atlas vertebrae. And you definitely need to know atlas compared to our C2 vertebrae, which is the axis vertebrae right here. And so you can see that as well. And so there's the axis vertebrae, and that, of course, forms the pivot joint. You can see the head. Notice this little spot is known as the dens of the vertebrae. It's one of the few unique areas of our C2 vertebrae that I expect you to recognize specifically. So right now, looking at the atlas vertebrae from a superior view, these are the common things that you should be able to identify. Number one, you should know that this is the spinous process. This is the posterior side of the vertebrae, so this has to be the spinous process. All right. Number two, can you identify the transverse foramen on the, again, atlas vertebrae? It's the first vertebrae, which is C1. So that's the transverse foramen. Technically, this part sticking out is the transverse process, which would definitely still be fair game to identify and expect you to be able to label. All right. Then on this anterior side, all right, so the anterior side, you should know this is called the faucet dentis. All right, DENTIS, faucet dentis. And that's where, of course, the dens of the C2 vertebrae is going to be found, which I'm going to show in just a minute here. The final thing with vertebrae that you should almost always be able to identify is, in this case, this is the superior articular faucet. All right, articular faucets are sites where you're going to have, in this case, this would be articulating with, of course, the occipital condyles. But in the inferior version, the inferior articular faucet, that would be articulating with the other vertebrae or the C2 vertebrae. All right, and so that's what we are dealing with here is this specific vertebrae that you should be able to identify. Again, your main points, can you identify transverse foramen? Can you identify transverse process? Can you identify spinous process? And can you identify the faucet dentis down here? Because again, that's where the dens would be. So the faucet dentis here, again, DENTIS. And then can you identify superior articulate facet? And if I reverse this, I'm not going to probably do that, but if I reverse it, do you know that there's an inferior? I'm probably only going to, yeah, I'm just going to focus only on the superior view here for the atlas vertebrae. But I'm going to swap out the atlas vertebrae and get rid of the atlas and move on to the axes vertebrae, which is the C2. And so here you can see the C2 vertebrae. All right, there would have been C1, and here's C2. So notice when we do C1, notice the spinous process is the posterior side, all right, which is kind of unique. So pay attention. The spinous process is actually the posterior side, which hands down you need to be able to recognize. You also need to be able to recognize the dens, which is this superior portion right here. And I'm going to give you a different perspective in just a little bit. But notice we also have the superior articulate faucets as well sitting on there. But the dens is the unique thing that says, hey, that is for sure the axes vertebrae. And if you forgot, like I said, C1 is C2, AT is before AX, right? T is before X, 1 is before 2. So that's the way I remember it. And the dens should be a giveaway that this is the second vertebrae. You just need to be able to recognize it as the axes vertebrae. Still have the superior articulate faucets. You're going to start learning some of the other structures as we move forward, but this space right between here that kind of joins kind of where this L shape to what is essentially would be the body of the vertebrae, which again, I'm going to call this the dens. That's what you need to know. But this is going to be known as this little strip right here is going to be the lamina. And then this little connecting point is going to be the pedicle, which is going to make more sense later. So don't get too caught up on that. You still can see that there are transverse processes, and then technically there is the transverse foramen. It's kind of hard to see on this perspective, but you can kind of see that there's a little bit of a hole starting to show there. It's just to show you that there still is, even in this cervical vertebrae, there is still a transverse foramen because that's where blood vessels go through and nerves. All right, but that kind of covers the main points: spinous process, superior articulate faucet, and the dens of the vertebrae. This isn't the best of views, so I probably would not use the transverse foramen. All right, but that's kind of the main points I wanted to cover with C1 and C2, and we're just going to move on now to the cervical vertebrae. All right, and all the cervical vertebrae look very similar. They look like these. As you can see, I can stack them up. But we're just going to look at one of them, and we're going to look at technically the fifth cervical. I mean, if I did the sixth, you can see it's still kind of the same exact thing. I'm just going to use the fifth cervical vertebrae and really point out, again, key markings on here. And so when we're dealing with the key markings, again, we have our spinous process, but the giveaway that this is a cervical vertebrae, the giveaway hands down is the transverse foramen right here. That is the giveaway. All right, so I expect you to be able to look at this and say, hey, that's cervical vertebrae. And I usually would give you multiple perspectives. Right now, I'm focused on a superior perspective. That's because that's how I have the model set up. And usually it's the easiest to make sense of is looking at a superior perspective, which I really prefer to do for students, especially being so new to anatomy and physiology. All right, so here we have a cervical vertebrae. You can definitely tell because of the transverse foramen. You need to know and learn that this section is known as the body of the vertebrae, and that's going to be universal. All right, this little line right here that's connecting everything. So this little spot is the pedicle. All right, so that's the pedicle. And then here, each of these little spots, this little line right here, this is known as the lamina. All right, so that's the lamina. We have the spinous process. And then, of course, don't forget about the vertebral foramen, and that, of course, is where our spinal cord passes. Very easy for me to ask, just as a straight-up lecture question, where does the vertebral column, or the spine, pass through? It passes through the vertebral foramen. All right, and you might hear that, and you'll see in your book that they call this the vertebral arch. I don't ever label that, so just know this is lamina, all right, because I'm going to put individual arrows there instead of putting like a rounded arrow like that. So lamina, spinous process, vertebral foramen. This is technically the this is the transverse foramen. This is technically the transverse process, which is pretty rare for me to label. If I'm going to label transverse something, I'm going to label the transverse foramen because it's so unique to the cervical. You got the body, you have the pedicle, you have the vertebral foramen. The only other thing that you need to make sure you can identify is the superior articulate faucets. All right, and that's pretty straightforward on this model here. So the superior, the inferior are a little bit different, and we're going to start seeing them a little bit more exaggerated as we move on to the thoracic vertebrae. But essentially, this covers everything you need to know for your cervical, and the cervical vertebrae are a little more complex due to the fact that we're dealing with the atlas at first, the axes, and then the cervical. But most things were the same. The difference was you need to make sure you can identify the dens, um, and that was kind of the main point with the axes vertebrae. And then the other big picture, remember, is the faucet dentist for the atlas vertebrae. So axes and atlas, you really need to work out. Now we're just down to thoracic. So I'm going to bring up a thoracic vertebrae here. And so you can see the spinous process is pretty long there. Let me see. You can see the spinous process there as well. And so early on in T1, this is the T1 vertebrae. We're labeling, if you remember, T means thoracic. You can see this is pointing almost directly straight backwards. But your key points are most of the structures are the same. We have our spinous process. This would be the lamina. This would be the vertebral foramen. This is the transverse foramen, the transverse process, spinous process, transverse process. We don't have a transverse foramen. So I know right off the bat that this cannot be cervical based on that. We have the minor pedicle right there. So that's the pedicle. We have the body, vertebral foramen, and that is it. And that kind of finishes and wraps up the thoracic. So the thoracic giveaway is this long spinous process. I'm going to come back to this and point out how you can identify the thoracic vertebrae, but I'm going to pull up a different thoracic vertebrae. And so I pulled up T8. So this was the first one. Notice that spinous process is all of a sudden really sticking straight down, and that's what I want you to know. So the spinous processes of the thoracic vertebrae are really sharp, and they're almost pointed downward. And then this also gives us the perspective of the superior articulate faucet, which is right here, or process. You can call them a process. The process is the projection. The faucet is the smooth side, but I'll give you that perspective from a side view in just a little bit. So this is all superior views because I have to reshift and rearrange the model. So I'm only doing superior views right now. But notice the spinous process, because we are looking at it from a superior view, notice the process is pointing inferiorly. And that'll make a little bit more sense when I get the vertebrae set from a side perspective versus a superior. All right. And what that leaves us with is, of course, our lumbar vertebrae. And I'm just picking the third lumbar vertebrae for us on this case. Unfortunately, it's not giving me a chance to really set this vertebrae up centered, but give me 1 second here. And so hopefully this centers the vertebrae just a little bit better, takes away a little bit of white from that screen. But just to point out, notice a huge body. That's the giveaway for lumbar vertebrae, is a huge body, and notice a pretty dull spinous process. Yes, it's still sticking out, but it's dull, and I'm going to again show it from a lateral perspective in just a little bit. Same setup. We have our lamina right here. We have our pedicle right here. Transverse processes right there. Spinous process there. Body. And of course, our vertebral foramen right there. So if you're getting these down, you're getting exactly down what you need. I think this gives you a better perspective than just looking at images by themselves, but I at least wanted to point these things out. And now I'm going to start moving on to give you a side perspective, and that'll wrap up the rest of this section here. So here is a lateral perspective. Right now we're looking at the anterior portion of our atlas vertebrae. You can see the spinous process that I said you needed to know. And you can see when we talked about, of course, that the faucet dentist, which is right here. That's the faucet dentist. You can see that's going to hold the dens. And I'll just quickly add on the L2 vertebrae, or sorry, L2, C2 vertebrae, or the axes. And you can see that the axes vertebrae sits right there, and there's the dens. And again, you can see the spinous processes. You can see the transverse foramen right there. You really can't see the vertebral foramen. It's a little bit hard to see, but you can at least see some of the spinous processes in the vertebral foramen and how they're sitting and how they're interacting. You know, this perspective probably a lot better from a superior view to label these up, but this at least shows you the inferior. All right, so this is the inferior articulate facet, which is pretty decent, nicely shown there. And I'm just going to add the C5 vertebrae, and give me 1 second to get that in view. And so this shows you the C5 vertebrae. I just added onto it. You can see it right here. And again, we're seeing some of the same structures. Not my favorite perspective to show you the cervical vertebrae by any means. It's kind of tough to see, but it is starting to show you how the facets sit. And you can kind of see here's the superior articular facet, here's the inferior articulate facet. All right, but cervical vertebrae, just assume I'm probably going to go with a superior view for them. And then you can see the body here, but hands down, you see transverse foramen, and you can kind of see the hole right there. You see a transverse foramen, it's instantly cervical vertebrae for you. All right, so let's move on and take a closer look or a lateral look at the thoracic vertebrae. All right, and so this is your thoracic vertebrae. And as I've said, thoracic vertebrae have these long, pointy spines that are their giveaway. And the unique feature is these are the vertebrae that articulate with the ribs. So the ribs articulate in these specific vertebrae here. But the biggest thing that I typically am pointing out is, of course, from this lateral sort of perspective here, is you should definitely know the spinous process, easily be able to see that. Transverse process right there. You can see the superior articulate facet. If you notice down here, this is the inferior. And so you can see how the inferior and the superior articulate facets articulate. So notice the superior facet is actually facing posteriorly, while the inferior facet, which is this one, you can see is facing anteriorly. So the posteriorly facing superior articular facet articulates with the inferior articular facet of the vertebrae just above it. And that's what we're seeing right there. All right, and you can notice the spinous process starts to dull out as we get closer and closer. This is T11 and this is T10. This is T7. So this is the seventh, and you can see, you know, we really get these sharp spinous processes. And this is kind of where it starts changing a bit and almost becoming, starting to look almost like a lumbar vertebrae. But this is my typical model that I use, especially again for this being the first anatomy class you've likely had at college level. I'm going to stick with a view where you can clearly see a really sharp downward spinous process. So this is the main one, but this shows you how they interact, which I felt was important. And then intervertebral discs would sit right in this area right here, which we know is made up, of course, of fibrocartilage, right? So that's what we're dealing with here, and that's what we're talking about when we look at this. But can you name those marks? Can you see the superior articulate process in this case? And of course, facet is the smooth side. And again, you see the superior facet, the smooth side is the facet, which articulates. But it's also called a process, but this is the facet side. If we were labeling it here, it's from the process. If you put either or answer, you're going to get it correct if I'm having you write it out. And if it's multiple choice, I would only use one of the two answers. So there's no way you can say, oh, well, he didn't have he didn't have facet. Well, I would have process. And if I didn't have process, the other answer would be the superior articular facet. So either way, I accept multiple answers for those, but you should know them. And they're well seen here. But we see the body, we see the transverse process, we see the spinous, we see the superior articulate facet, inferior articulate facet. Technically, this is where the pedicle would be. I really couldn't label lamina from this perspective. Lamina I would need to save specifically for a superior view. I wouldn't be too comfortable labeling the lamina there. All right, so we're down to our last vertebrae here, and I hope this lecture is helping make and clarify some of these important structures. But we're down to our last vertebrae, which is going to be the it's going to be the lumbar. And the key with the lumbar, if you remember, is a massive or a giant body to it. And so these are the lumbar vertebrae L1 at the top here, and this is your L4, just to give you an idea. You can see a pretty blunted, they're not sharp, they're not really pointing downward anymore. So really blunted spinous process, and the bodies are just massive. The bodies of these are significantly large. Notice this is really large, so I'd probably be using the L4. L1 is more of a transitional one. It kind of blends. Notice if I add thoracic on there. Hard to distinguish between those. All right, but as I said, I would not use a T. This is thoracic 12. I would not use something like that. I'm going to stick to one that has that sharp process because my goal is to teach you the obvious stuff right now. And then if you were to pursue more anatomy, you can work out the details and work out comparing and contrasting like a T12, right? T12 vertebrae here to our L1, and you can see they're very similar, but I'm going to focus on the significant differences. So I'd be using something more like this, and so I'm going to remove that one. And so again, look for a dull spinous process and notice, and I hope you noticed the superior articulate faucets are no longer pretty much straight facing posteriorly. They're kind of angled inward, and you can kind of see the inferior articulate faucets are a little bit more obvious. And that's another feature, but I think if you see this from this view, seeing this dull and it's not pointing sharp, you should easily be able to tell that this is a lumbar vertebrae. And that's kind of the major points related to this concept here. So make sure you're identifying the vertebrae. It is an important task, and that kind of wraps up the important parts of the axial skeleton, specifically focused on the vertebral column and the thoracic cage. We still have, there was a different and separate video that you should review for the skull. So the skull is a little bit different, all right? And before I close out, I really just want to point out, we talked about elastic tissue. So if you remember, we went through one of our dense connective tissues was considered elastic tissue. And we said it was located, its ligaments between the vertebrae, but this is intervertebral discs, all these, kind of pinkish colors. All right, so these are the intervertebral discs. These are made up of fibrocartilage. So when we say between or linking up the vertebrae, what are we talking about? Well, to give you an example, the elastic cartilage, or not elastic, the elastic tissue that we were talking about, I'm about to display it. Notice all that came on, that's the elastic tissue. So notice there's these little fibers on the sides of the transverse foramen. You can see there's a big connective tissue over there. Notice I'm going to remove it really quick, add it back on. All of those that we're adding in, that's where you find your elastic tissue. Elastic tissue is pretty rare. It's also found with lungs and tissues that expand and need to return to original length. But one of the major locations I stress is the outside the vertebrae, or connecting or linking vertebrae. It's different than intervertebral discs. All right, so I remove that, add it back on. That is your elastic fibers. All right. But I hope all this made sense. I hope this gave you some pretty good perspectives here, all right, about what the axial skeleton certainly is. You start to see everything, and we start to make these connections here to exactly the axial skeleton, which we're pretty much showing right now. As always, if you have specific questions, please do not hesitate to contact me. Please let me know. And again, this is your complete axial skeleton right here. This whole thing right down there. All right, but I hope all that made sense. As always, if you have questions, just make sure you let me know. Take care. Have a great rest of your day. I think this does a good job of filling you in on the key aspects for the lab related to the vertebrae, or the vertebral column, and the thoracic cage as a whole. Again, there's a skull video. There are the appendicular upper skeletons. There's the appendicular lower skeletal videos. Make sure you watch those, because I am giving you clues as to the specific structures. And since, if this should help prepare you, if we have access to models, this should give you a great insight to say, hey, I'm going to come into lab and specifically look at those models. If this is all online, you can expect to see some images on the exam similar to this, me labeling up different perspectives. So just make sure you are well aware and practicing these structures, because they are important. Thanks for listening.